Good day, everyone. We are Group 7, and today we will be discussing the reproductive system sex reassignment surgery. Let's start by defining sex reassignment surgery, also known as gender affirmation surgery. According to Thomas 2020, this surgery is a medical necessity for transgender patients with gender dysphoria who want to achieve their transitional goals physically and socially in accordance with their gender identity. Once done, it may also help trans people get over their emotional and physical pain that gender dysphoria causes.
Then, which areas are appropriate for sex reassignment surgery? Depending on the person's transition objectives, sex reassignment can be performed on different bodily parts. To achieve a more masculine or feminine characteristic, this includes the breast or chest, the genitalia, and even the face.
The different types of sex reassignment include a penile inversion operation called feminizing vaginoplasty, which creates a vaginal vault between the rectum and urethra, where the vagina of a non-trans person would typically be, and lines it with penile skin. In a procedure known as masculinizing phalloplasty or scrotoplasty, a penis is made for a trans man utilizing flesh from either their arm or lateral thigh. On the other hand, scrotoplasty is a procedure to add a scrotum. Skin flaps are also used in this, and testicular implants are not required. Metoidioplasty or clitoral release enlargement is another operation to construct a penis. The skin from the labia or outer labia is used in this technique to create the penis and scrotum. For the purpose of lengthening the penis, the clitoris is severed. Additionally, the urethra can be lengthened and integrated into the penis. Another kind is masculinizing chest surgery, which modifies the person's chest to resemble a more male appearance. Also, the nipples can be moved and resized. Facial feminization surgery is a method for changing the shape of the face. A few examples include moving the hairline to make the forehead smaller, emphasizing the lips and cheekbones, or reshaping and resizing the jaw and chin.
Reduction thyrochondroplasty, also known as tracheal cartilage shaving, is a technique that lessens the appearance of the thyroid cartilage, sometimes known as the Adam's apple, according to Theratil 2019. Voice surgery, on the other hand, alters the vocal folds or mass to raise the pitch of the patient's speaking voice. Surgery is most frequently performed on trans women because a majority of trans men find that hormone prescriptions work virtually always for voice changes. One further option is augmentation mammoplasty, which is not just for transgender people. Under the pectoral muscle or beneath the breast tissue, saline or silicone implants are put in during the surgical operation. The surgery to remove the uterus is known as an orchiectomy or hysterectomy. One or both testicles may be surgically removed during the process called orchiectomy. Lastly is the vaginectomy, a surgical operation in which the vaginal epithelium and vaginal canal are removed.
Now, let's move on to the next question, shall we? How does the male to female surgery work? A surgeon makes like become like during this procedure by using certain parts of your original penis to create a sensate new vagina. First, a procedure called orchiectomy is done, where the testicles are removed. Next, the skin from the scrotum is used to make the labia, and the erectile tissue of the penis is used to make the new clitoris, while the urethra is preserved and functional.
Let us dive further deeper into orchiectomy. Orchiectomy or orchiectomy is where you remove one or both of the testicles surgically. The testicles are two small organs that hang in a scrotum or a sac of skin below the penis. It makes sperm and male hormones, including testosterone. This procedure is optional for transgender women. Healthcare providers perform this procedure to either treat or prevent the following: testicular cancer, prostate cancer, and male breast cancer. And due to this being an outpatient procedure, you are able to go home the same day.
You might be asking who might need an orchiectomy. This procedure can serve as an initial diagnostic and treat cancer in the testicles. It's also used as a treatment for male breast cancer and prostate cancer. An orchiectomy shrinks tumors by cutting off male hormones that help them grow. Androgens, a male hormone, encourage some cancer cells to grow. Without the testes, hormone levels drop. It also helps transgender women transition. Transgender women or trans women choose to have an orchiectomy. This is a surgical procedure that greatly reduces male hormone levels in the body. It can be done as a single surgery or as part of comprehensive gender reassignment surgery. Lastly, removing damaged testicles. Sport injuries, motorcycle accidents, and other trauma can cause severe damage to the testicles. If unrepairable, they remove it and stitch up surrounding tissues. In rare cases, providers may need to remove an undescended testicle.
What are its risks? Risks of an orchiectomy include bleeding and infection. Patients may also develop bothersome swelling in the scrotum. Complications and side effects depend on the type of surgery you had. The risks of male-to-female surgery, according to the American Society of Plastic Surgeons, include but are not limited to bleeding, infection, poor healing of incisions, hematoma, nerve injury, stenosis of the vagina, inadequate depth of the vagina, injury to the urinary tract, abnormal connections between the urethra and the skin, painful intercourse, and anesthesia risks.
Female-to-male surgery can take many various forms, such as mastectomy, the removal of the breast, and bottom surgery, the alteration of the genital area. Examples are hysterectomy or the uterus removal, vaginectomy, vagina removal, and the construction of the penis through metoidioplasty.
Before having female-to-male gender-affirming surgery, one or more of the following procedures might be performed on them: chest restructuring to remove breast tissue, removal of the uterus, ovaries, and fallopian tubes. Also, surgical procedures metoidioplasty, phalloplasty, and scrotoplasty, which should be discussed in the following slides.
First, metoidioplasty, or the method of construction of a new penis called neopenis. During the procedure, the surgeon also removes the vagina in vaginectomy. The urethra is also lengthened and positioned through the neopenis. The aim of this is to allow the person to urinate while standing. Another option is the centurion procedure, which increases the girth of the penis.
Next is phalloplasty, where you use grafted skin, usually from the arm, thigh, back, or abdomen to form a neopenis. This is similar to a metoidioplasty but results in a larger penis. Disadvantages include the number of surgical visits and revisions that may be necessary, as well as the cost. After a period of recovery, a person can have a penile implant. This can allow them to get and maintain erections and penetrative sex. Lastly, the scrotoplasty. A person may decide to have a scrotoplasty or the creation of a scrotum alongside a metoidioplasty or phalloplasty. It involves hollowing out and repositioning the labia majora to form a penis, then inserting a silicone testicular implant. Some complications of a metoidioplasty or phalloplasty include the following: the urethral fistula, a tunnel connection that forms between the urethra and another part of the body, as well as the urethral structure, a narrowing that causes a blockage of urine flow within the urethra.
A person who has had a phalloplasty may experience scarring in the area where the graft was taken, and skin graft failure or tissue death. According to Leonard 2019, the risk of a scrotoplasty include rejection of the testicular implants. The American Society of Plastic Surgeons stated that the possible risk of female-to-male surgery include bleeding, infection, poor healing of incision, hematoma, nerve injury, failure of the transplanted tissues to survive, unsightly scars, exposure of the prosthetics, injury to the urinary tract, abnormal connection between the urethra and the skin, painful intercourse, and anesthesia risks. That is all for our presentation. Hopefully you were able to grasp the topic and learn something new. Thank you so much for listening.